Have you ever opened your fridge, looked at the veggies inside, and thought, they're all good for me? They're veggies after all? Well, once you're past 60, the body doesn't respond to food the same way it used to, and some of those everyday vegetables can actually make certain health issues worse, even when you've been eating them for years. As a doctor here in Australia, I often see older patients dealing with things like fluctuating blood sugar, stubborn reflux, joint pain, bloating, or medications that don't work as well as they should. And quite a few of these problems come from foods they'd never suspect, including a handful of very common vegetables. Today, we're going to go through 9 vegetables older Australians should be cautious with, not to scare you off healthy eating, but to help you understand why some veggies can irritate the gut, why a few can drive up inflammation or impact blood sugar, and which ones may interfere with your medicines without you realizing. This isn't about cutting vegetables out of your life. It's about making smarter choices so your meals support your heart, your digestion, your joints, and your overall quality of life. And I'll tell you now, number 7 is the one most people never see coming. Let's get into it. Let's start with bell peppers, or capsicum, as we call them here in Australia. They're bright, colourful, and packed with vitamin C. But for many older Australians, capsicum can be surprisingly hard on the digestive system, especially when eaten raw. One thing I see quite often in patients over 60 is reflux that flares up without a clear reason. Capsicum is a common trigger. Certain compounds in capsicum can relax the valve that keeps stomach acid where it belongs. When that valve loosens, acid can move upward, causing that familiar burning sensation in the chest or throat. There's another layer to this as well. Capsicum belongs to the nightshade family, along with tomatoes and eggplant. For most people, that's not an issue. But for some older adults living with arthritis or long-standing joint pain, nightshades can aggravate inflammation and make symptoms feel worse after a meal. Now, this doesn't mean every senior needs to cut out capsicum completely, but if you've noticed reflux after salads, discomfort after raw veggies, or your joints feeling more irritated after certain meals, capsicum may be part of the picture. Cooking it gently, roasting or sautéing, often makes it easier to tolerate. But if you're still experiencing symptoms, it may be worth swapping it out for milder options like zucchini or cooked carrots, which are far easier on the digestive system. The takeaway here is simple. If capsicum keeps upsetting your stomach or your joints, your body's sending you a message, and it's worth listening. Next on the list is beetroot, a staple in many Aussie kitchens from salads to sandwiches. It's a nutrient-rich vegetable, no doubt about that, but it can cause issues for older adults that often go unnoticed. One of the main concerns is how naturally high in sugar beetroot is. Even though it's a healthy sugar, it still affects blood glucose in a very direct way. For anyone managing diabetes, pre-diabetes or fluctuating blood sugar, which is extremely common after 50, beetroot can cause readings to spike more than expected. Another point many people aren't aware of is its oxalate content. Oxalates are compounds that, in large amounts, can contribute to kidney stone formation, and unfortunately seniors are more susceptible to kidney stones due to age-related changes in hydration, kidney function, and medication use. So while beetroot supports circulation and blood pressure for some people, for others the impact on blood sugar and kidney health can outweigh those benefits. If you enjoy beetroot, you don't necessarily need to remove it entirely, but portion control makes a significant difference. Choosing roasted or steamed beetroot instead of juice also helps, as beetroot juice delivers sugar to the bloodstream much faster. If you've ever noticed your blood sugar creeping up after what seemed like a healthy meal, or if you've had kidney issues in the past, this is one vegetable worth treating with extra caution. Now let's talk about Brussels sprouts, a vegetable many Australians either love or avoid entirely. Nutritionally, they're impressive. Plenty of fibre, antioxidants and vitamin K. But for older adults, they can also be surprisingly heavy on the digestive system. As we age, the gut becomes slower and less efficient at breaking down certain types of fibre. Brussels sprouts contain a dense, fibrous structure along with natural sulfur compounds. When those two combine, they can produce a lot more gas, bloating and discomfort than most people expect. I see this quite frequently in patients dealing with slow digestion, irritable bowel symptoms, or long-standing constipation. A serving of Brussels sprouts, especially if they're undercooked, can leave them feeling tight through the abdomen, overly full, or uncomfortable for hours afterwards. Another detail worth noting is how sulfur-rich vegetables interact with the gut. For some seniors, those sulfur compounds trigger fermentation more aggressively, leading to increased bloating and sharper cramps after meals. That doesn't mean they're a bad food, but if you're over 60 and finding your stomach reacts unpredictably, this is one vegetable you may want to approach more gently. If you enjoy Brussels sprouts, the best way to make them easier to tolerate is to cook them thoroughly. Avoid combining them with other gas producing foods and start with a smaller portion to see how your body responds. For some older Australians, choosing softer vegetables like steamed pumpkin or zucchini provides the same nutritional value without the digestive fallout. Moving on, we have okra, a vegetable used widely in African, Middle Eastern, and Asian cooking, and increasingly common here in Australia as well. It's high in fibre and has a unique texture, but for many older adults, okra can create more digestive trouble than expected. One of the main reasons is its content of fructans, a type of carbohydrate that some people struggle to digest properly. In seniors, where digestion naturally slows and the gut becomes more sensitive, fructans can lead to bloating, excessive gas, and uncomfortable cramping after meals. Okra is also known for its slippery mucus-like texture. While that's useful in cooking, it can be difficult for older Australians who have dentures, weakened chewing muscles, or mild swallowing difficulties. Foods that are sticky or gel-like can take more effort to manage safely. Another point worth mentioning is its oxalate level. Similar to beetroot and spinach, okra contains enough oxalates to contribute to kidney stone formation in people who are already at risk, and that risk increases with age, dehydration, or certain medications. Now, this doesn't mean okra needs to disappear from your plate entirely, but if you notice digestive symptoms after eating it, or if you've had issues with kidney stones in the past, it's sensible to be cautious. Cooking okra thoroughly can make it easier on the stomach, but for many seniors, gentler vegetables such as green beans, zucchini, or lightly steamed carrots tend to be far more comfortable and predictable. The message here is simple. If okra leaves you feeling bloated or uneasy, it might not be the best fit for your digestive system anymore. Let's move on to garlic, a favourite in many Australian kitchens and well known for its immune and heart benefits. But while garlic is a powerful food, it can also create issues for older adults, particularly when eaten raw or consumed in large amounts. One of the biggest concerns is how garlic affects blood thinning. Garlic naturally reduces the blood's ability to clot, which is normally helpful. But if you're taking anticoagulant medications such as warfarin or certain heart medications, garlic can intensify the effect, increasing your risk of bruising or unexpected bleeding. Another thing I see frequently in patients over 60 is digestive irritation. Raw garlic contains strong sulfur compounds that can inflame the lining of the stomach and esophagus, triggering heartburn, burning discomfort behind the chest, or reflux that lingers for hours. Even cooked garlic can cause problems for individuals with a sensitive stomach, though it is usually far easier to tolerate than the raw form. If you enjoy garlic, the key is moderation. A small amount in cooked meals is usually fine for most seniors, but large servings, particularly garlic supplements or strong raw garlic, may not be the best choice if you're dealing with reflux, chronic gastritis, or blood thinning medication. If you're unsure, it's worth having a chat with your GP, especially if you've noticed changes in digestion or bruising more easily than usual. Garlic still has its place in a healthy diet, but for older Australians it's important to use it sensibly rather than assuming more is better. Now let's take a closer look at tomatoes, a household favourite across Australia, whether it's in sauces, soups, sandwiches or salads. They're rich in antioxidants and certainly have nutritional value, but for many older Australians, tomatoes can be surprisingly tough on the digestive system. The main issue is their acidity. As we age, the valve between the stomach and the esophagus becomes weaker, making reflux far more common. Acidic foods, particularly tomatoes, can irritate that valve and trigger burning discomfort, sour reflux, or a feeling of tightness in the chest after meals. And here's something many people don't realise. Cooking tomatoes actually concentrates their acidity, especially in products like tomato paste, canned tomatoes, and rich pasta sauces. This can make symptoms flare up even when you think you've had only a small amount. There's also the fact that tomatoes belong to the nightshade family. For some older adults with long-standing arthritis or chronic joint pain, nightshades can worsen inflammation and lead to noticeably stiffer or more painful joints the next day. None of this means tomatoes are bad, but it does mean they're not suitable for everyone, particularly if you're over 60 and dealing with reflux or inflammatory conditions. If you enjoy tomatoes, you might find gentler alternatives like yellow or orange tomato varieties, a lighter, less concentrated sauce, or diluted tomato-based soups. Balancing acidic foods with non-acidic vegetables also helps reduce irritation. The goal isn't to eliminate tomatoes completely, it's to understand how your body responds and adjust accordingly, so your meals support your health rather than aggravate it. Moving on, let's talk about radishes. Those sharp, crunchy vegetables many people add to salads for a bit of flavour. They look harmless, but for older Australians, radishes can be surprisingly irritating to the digestive system. Radishes contain compounds that give them their spicy bite. While completely natural, these compounds can irritate the lining of the stomach. especially in people over 60 whose digestive tract has become more sensitive with age. As a result, some seniors experience bloating, cramping, excess gas, or a general feeling of stomach discomfort after eating them. For those living with irritable bowel symptoms or a history of digestive sensitivity, radishes can push the gut into overdrive, making mild symptoms suddenly much more noticeable. Another consideration is their diuretic effect. Radishes encourage the body to pass more urine, which isn't necessarily a bad thing, but for older adults taking diuretic medications, or for anyone managing kidney or fluid balance issues, this can become problematic. Excess urination can lead to dehydration or electrolyte imbalances faster than most people realize. Now, radishes can still be enjoyed in moderation, but it's worth paying attention to how your body reacts. For many seniors, simply cooking radishes, roasting, or lightly steaming them helps reduce their harshness and makes them much easier to digest. And if you're after something crisp without the digestive trouble, gentler options like cucumbers or celery tend to be far better tolerated. The main message here is this: if radishes consistently leave your stomach unsettled, it's perfectly reasonable to swap them out for something kinder on your system. Now let's take a closer look at chard, often called Swiss chard, a leafy green packed with minerals like magnesium and potassium, along with vitamins A, C, and K. Nutritionally, it ticks plenty of boxes, but for older Australians, it also comes with two important concerns that are easy to overlook. First is its oxalate content. Chard sits in the same category as beetroot and spinach when it comes to oxalates, and these compounds can increase the likelihood of kidney stone formation in people who are already at risk. As we get older, kidney filtration becomes slightly less efficient and dehydration is more common, both of which make oxalates more problematic. The second issue is its very high level of vitamin K. Vitamin K plays an essential role in blood clotting, which is normally beneficial. But if you're taking blood-thinning medications such as warfarin, eating large amounts of chard can interfere with the way your medication works. This can lead to inconsistent INR results or unexpected changes in clotting behavior, something we always want to avoid in older adults. This doesn't mean you need to avoid chard completely. But if you're on anticoagulants or have a history of kidney stones, it's important to approach it with mindfulness. Cooking chard, boiling or steaming it, can help reduce its oxalate load and make it a little easier for the body to manage. For many seniors, rotating in gentler greens such as cos lettuce, kale, or silver beet can provide similar nutritional benefits without the same level of risk. The key takeaway here is simple. Chard is nutritious, but not always suitable for those managing blood-thinning medication or kidney concerns. Knowing how your body and your medications respond helps you make safer choices. Finally, let's talk about onions, a staple in almost every Australian kitchen. They add flavour, depth, and aroma to countless dishes, but for many people over 60, onions can be far more irritating to the digestive system than most realise. Raw onions contain strong sulfur-based compounds that can inflame the lining of the stomach and esophagus. For older adults who already experience reflux or a sensitive digestive tract, onions can quickly trigger burning discomfort, bloating, a tight, gassy feeling after meals, or a flare-up of long-standing heartburn. Even when cooked, onions can still cause issues because they hold a relatively high amount of insoluble fibre, the type that ferments easily and produces gas. As digestion naturally slows with age, these effects become more noticeable, especially in those with IBS or chronic indigestion. Some seniors also find the strong odour and sharp compounds in onions linger longer than they used to, leading to discomfort that lasts well beyond the meal itself. Now, this doesn't mean you need to remove onions from your diet entirely. Cooking them thoroughly tends to soften their impact, and gentler varieties like shallots, spring onions, or lightly sautéed leeks are generally much easier on the stomach. The key is paying attention to how your body responds. If onions repeatedly leave you feeling unsettled or trigger reflux, it's perfectly reasonable to switch to milder alternatives. Your digestive system will thank you for it. So what does all of this mean for you? Vegetables are still an essential part of a healthy diet. That doesn't change. But as we get older, the way our body digests food, handles inflammation, and processes medications does change. And that's why certain vegetables, even the ones we've eaten for decades, may suddenly become less suitable. The goal isn't to create fear around food. It's about understanding how your body works now, not how it worked 20 or 30 years ago. When you know which vegetables tend to trigger reflux, raise blood sugar, irritate the gut, or interfere with medication, you're in a much stronger position to make choices that genuinely support your well-being. Most of the time, it simply comes down to sensible portions, choosing gentler alternatives when needed, cooking foods in a way that's easier on the stomach, and having a quick chat with your GP if something doesn't feel quite right. Small adjustments can make a remarkable difference. less discomfort after meals, steadier energy, and better overall control of long-term conditions. Thank you for watching. And remember, your diet should work with your body, not against it. If you'd like to stay informed with more practical, evidence-based advice tailored for older Australians, feel free to join me in the next video. Stay well and take care of yourself. And